In today's video, we will be discussing the topic of knowing loved ones' end-of-life healthcare wishes. Attachment security predicts caregivers' accuracy. Before we discuss how different attachment styles can predict loved ones' end-of-life healthcare wishes, we first need to understand what effective relationships consist of. First, successful relationships requires understanding of each other's concerns, wants, and needs. When relationships have this understanding, it allows partners to improve their efforts to be supportive. For example, a mother's accuracy in recognizing and interpreting her infant's signals leads the baby to expect that the mother will provide support when needed. Additionally, when parents become elderly, they can also expect that their adult children will provide support if needed. According to research from Turan, since being understood by loved ones is an essential characteristic of successful relationships, an attachment theoretical perspective may be useful in examining adult children's accuracy in predicting end-of-life healthcare wishes for their parents. He further explains that because people develop specific attachment patterns that guide their thoughts and behaviors in close relationships, attachment orientation influences the probability that adult children know their parents' end-of-life healthcare wishes. In this video, we will be discussing 3 attachment orientation types and their accuracy in predicting their parents' end-of-life healthcare wishes. We will be discussing secure attachment, attachment-related anxiety, and attachment-related avoidance.
Attachments are often seen as a bond that people develop in their lifespan with other individuals. However, attachments are also how people respond during certain situations, pressures, and conflicts in their lifespan. Secure attachment orientation is categorized as a secure attachment which individual has flexibility, tolerance, and adapts better under such circumstances in all stages of life. According to the article, characterized by comfort in supporting exchanges in relationships and by regarding the self as competent in dealing with stress. So now, what does this mean? This means an individual that is independent and that has strong bonds with those around them, who can communicate about emotional well-being and other emotions throughout their lifespan. Secure attachment orientation starts as a child, when the child has less separation anxiety, seeks proximity in return of parent, self-regulates emotion and thoughts. As an adult, this person is relaxed, comfortable, enjoys the company of others, expresses himself with success. In the later points of life, this individual is more accurate in predicting loved ones' end-of-life wishes and overall succeeds and has a better mental understanding of the whole process in those life-end moments. Attachment-related avoidance, characterized by pushing others away when found in vulnerable situations, or according to the article, keeping emotional distance from close others, along with other insecure traits. An insecure form of attachment is attachment-related avoidance. Traits of such individual are categorized as someone who avoids being in stressful situations, conflicts, or simply in scenarios that place them in situations where they feel vulnerable in any form or way. These individuals tend to have the flight versus fight personality and behavioral characteristics. According to Fraley, theoretically, this aspect of attachment-related avoidance would also limit a person's accuracy in predicting the wishes of a close other at the point of end of life. Previous research also suggests that avoidant individuals use defense mechanisms to operate preemptively. In other words, they avoid thoughts that may leave them feeling vulnerable and distressed. Therefore, as a whole, the end-of-life decisions would result in reduced accuracy.
Attachment-related anxiety. Individuals with this attachment style experience as children separation anxiety and emotional distress when their parent would leave. They had dysregulated emotions and confused thoughts. As adults, they fear of abandonment by loved ones. They experience intense anxiety in relationships and have inappropriate sense of emotional and physical boundaries. According to the article, individuals with attachment-related anxiety have chronic worries about relationship partners' availability. They have intense attention about relationship partners' feelings and thoughts, improving accuracy about partners' perceptions. In stressful situations, they are overwhelmed by distress, making it difficult for them to process information successfully. However, they have greater accuracy about partners' desires in non-stressful situations, for example, planning a birthday party, but have lower accuracy in stressful moments, such as predicting loved ones' end-of-life healthcare wishes. To help you understand the difference between stress and anxiety is that anxiety can linger and may not have an identifiable trigger. Some of the symptoms are restlessness, tenseness, sweating, nervousness, and a feeling of unease or dread. Question. Consider the 3 forms of attachment discussed in the video. Which attachment orientation do you as an individual identify with at this stage of your life? How accurate is your prediction regarding your elder parents' end-of-life healthcare wishes? Thank you so much for watching.